right, I've got 5 minutes, and so it's going to be a bit of a whistle-stop tour, so I apologise in advance for that, but if anybody wants any further information, please do come and talk to me afterwards. So this was a project that wasn't really developed as a research project in any way. It's very much a sort of a convenient sample, and has really come about through our experiences of working with veterinary schools across Asia, and particularly building on a relationship that we have with the Kerala Veterinary and Animal Sciences University in southern India. There are a number of challenges to delivering high welfare within veterinary education across India. And one of those challenges is a lack of veterinary nurses. There is currently no veterinary nursing profession in India, similar to many countries around the world. And there is an estimated shortage of vets, and animal welfare problems are endemic within veterinary schools and veterinary teaching across India. So I've got a pointer. This dog at the top, you can see, has a buster collar on. We see lots of collars and restraints used, but no analgesia. And we know that one of the commonest reasons for wound interference post-operatively is pain. So buster collars are not analgesics. Putting a collar on a dog and physically obstructing it does not solve the problem. Hygiene and biosecurity, as you can see in the lower photograph, are challenges. In India, we do have livestock inspectors. They're sometimes called paravets. They receive 11 months of training, and that is primarily in production animal husbandry and nutrition, and not really clinically oriented. And there is a history of discord between vets and paravets in India because of the shortage of vets across India. Paravets, particularly in rural areas, have often stepped up to fill in that gap. And that means that there is a feeling of threat within the veterinary profession. They see paravets as encroaching onto their professional veterinary territory. And this has led to suspicion from the veterinary profession in India towards veterinary paraprofessionals in general. So what we were aiming to do was to improve an understanding of animal welfare within the veterinary teaching hospital at KVASU by showcasing how knowledgeable and professional, well-trained veterinary nurses can actually support vets, freeing up veterinary time, improving the patient experience within the hospital, and improving the clinical experience of the animals and the students and the vets themselves. So we were aiming to enhance inpatient experience through changing professional practice and fostering a desire for veterinary nurses in a situation where suspicion of veterinary paraprofessionals is endemic. And to support veterinary surgeons in developing their own veterinary nursing programs ultimately through working with higher level bodies such as the Veterinary Council of India. So we took a group of veterinary nurses across to India. We already had an existing relationship with KVASU. We'd run a number of animal welfare workshops there. And it was very important to us that this was very much a collaborative initiative, that it wasn't just us turning up and telling the vet school what they ought to be doing, but that it was very much supported and championed by them, and it very much was. The veterinary nurses that we took across worked alongside the Indian veterinary staff and the students within the veterinary hospital there. They showcased what veterinary nurses do. The first thing they did was clean absolutely everything, which I think was a huge shock for some of our Indian colleagues, because there is quite a hierarchical system within Indian veterinary hospitals, and it was quite shocking, I think, for them to see British qualified female professionals down on their hands and knees with buckets of disinfectant. But that was absolutely the first step in demonstrating the importance of things like biosecurity. Was, this is such an important subject that we need to make sure that we do it ourselves and it's done properly. We can't just leave it up to the cleaners who aren't trained in appropriate biosecurity. So by really engaging with our colleagues in India and by demonstrating from that very basic level the importance of not focusing on fancy equipment, but the importance of inpatient care, of providing food and water, of providing toileting opportunities, of ensuring that patients are clean, that they have access to analgesia, by that real sort of emphasis on all of these really basic things, it really sort of showed our colleagues the importance of veterinary nursing and also the importance of that solid foundation in delivering clinical excellence. We very much wanted feedback and collaboration from our colleagues, and it was really important to us to sit down at the end of the project and have a focus group with our Indian colleagues, and to allow them to reflect on what they'd seen and for them to guide us in sort of future collaboration and initiatives as well. So that stakeholder meeting was really important. And as part of that stakeholder meeting, we developed collaborative protocols for use in clinical areas relating to things like clinical standards of practice, hygiene, and inpatient care. And that was really useful for us because we discovered things like the colour that we selected for writing those protocols was actually quite important culturally, and that was something that we were unaware of and would have been a challenge for us if we'd just turned up with a protocol that we thought was appropriate to that particular situation. And as an outcome or as impacts of that, you can see the sort of landscape is much cleaner. There is a permanent inpatient manager now in the hospital there. And the veterinary nurses that we took across have been very much enthused and engaged with working overseas and wanting to develop their skills to be able to work overseas. And that participatory approach was really, really important to the success of this project. As I said, we learned from our Indian colleagues. We learned about the types of things that we could engage with. We were able to engage with difficult discussions around issues such as euthanasia or other challenging issues such as limb amputations, for example, or desexing, which can often be, there are different ethical viewpoints on. And we were able to implement changes with their support that were driven by them and suggested by them based on what they'd learned from their experiences with the veterinary nurses. So long-term follow-up, I just got this this week. This is from Professor Sharm, who's the head of the hospital in Phuket. And his feedback was, to sum up, they've put forth a major chunk of our recommendations in a positive manner, with a major thrust being given to the inpatient ward. And they're planning on coming up with more changes in the future, inspired by the experience that we've had together. Through the visit, the cleaning protocols have become more vivid and systematic. There are now spray bottles with disinfectants provided for all tables, which is just something that wasn't done before. And the training has instilled a considerable amount of empathy in our students and amongst our staff also. The training has given an insight into our students on how to control the animal in a very friendly manner. We did quite a lot of training on animal handling and how to deal with aggressive dogs and proper client management. It's definitely helped them to do better in minor surgical procedures such as wound dressing and bandaging, cannula placements, etc. So there have been, sounds very simple, things like having spray bottles of disinfectant on tables, but it's those small steps, that small engagement that then filters through in terms of clinical practice and can have a huge impact on things like inpatients being taken for a walk to be able to access the toilet on a daily basis, which has a massive impact on animal welfare. We've generated support through Kerala from the veterinary community for the training of veterinary nurses in India, and the Veterinary Council of India have recently proposed amendments to the Veterinary Council Act, namely the minimum standards for veterinary practice regulations, which include a greater emphasis on the role and use of veterinary professionals and a focus on training veterinary nurses for companion animal practice in India. So understanding the cultural and logistical landscape is essential for influencing human behaviour change. Having that relationship is really important. And I think human behaviour change can be supported and inspired externally, but it has to be driven from within a community, and it has to come from individuals which are familiar with their own cultural landscape. Thank you.